welcome. I'm Dr. Liana Lianov. I'm the founder and president of the Global Positive Health Institute, and welcome to our GPHI podcast, where we explore all things related to lifestyle medicine, positive psychology, positive health. And I'm delighted today to have as our guest Kathleen Jones. She's a longtime colleague and friend, glad to reconnect again. She is founder of Embody Change Coaching that develops and offers training for health and wellness coaches. She's been involved in several other training programs for health and wellness coaches. Has also been a core faculty for family medicine residency, and recently has co-authored a best-selling book on transformation and so much more. So I'm so excited to have you. Welcome.
Thank you so much. It's great to be here. Thank you.
Let's dive in. What first grabbed your attention to this whole area of healthy lifestyles, positive psychology, all of that?
Man, there's I'll try to keep it concise. First, I want to share just a little bit of, I want to create a little context, share a little bit of history. So you know a lot of this background, but so I taught in a lifestyle medicine training track within a family medicine residency. I'd been teaching health promotion, disease prevention for about a decade. And in 2005, so almost 20 years ago, came across lifestyle medicine and changed the curriculum. And it was exciting. We got a federal training grant. We did a lifestyle medicine symposium. We set up a lifestyle medicine clinic with coaches on site. And I tell you, it was a huge amount of work. And it was like every which way I turned, I was explaining and pushing this concept of lifestyle medicine because no one had heard of it. It was so brand new. So first it was the faculty docs that I was working with. Then it was the hospital administration meeting with the VPs. Then it was the entire medical staff, just trying to get all of these physicians and leaders on board, and which eventually happened. But the reason I wanted to say this is because the turning point was your article, and I have it here. This came out in 2010. So your article, I don't know if everyone can see this. Physician competencies for prescribing lifestyle medicine was really the first article in a professional medical journal online. I mean, there was a journal at the time, Lifestyle Medicine, but this, because it's such a prestigious publication, and because it was on competencies, it laid the foundation for those of us who were in training. So I tell you, so the day this came out, I ordered reprints for every member of our medical staff. I ordered copies of, I don't know if you could see, your signature is on there. I think I had shared with you, your co-author, Mark Johnson, is in Colorado. And so I drove 2 hours to Golden, Colorado. He was at, I think it was Jefferson County Health Department, met with him, had him sign my copy, you signed it. And the other thing that was so groundbreaking about this article was that JAMA not only is so prestigious, but it's across the board, every specialty, it's so, it's not just primary care. It's also cardiology and oncology and geriatrics and OB/GYN. I mean, every specialty is included. So I just want to say, Dr. Lianov, that this article turned everything around. It is what put lifestyle medicine on the map. It's what, like, I no longer had to explain, this is what we're doing and why. So I just want to say thank you for that. Thank you so
Thank you.
much.
Thank you for your enthusiasm for the field. And I'm so glad that that early work was so transformational. And you've been a great advocate for this and a great supporter. So thank you.
Yeah, it was exactly what was needed at that time. And if anything, I think you were ahead of your time. I shared with you a few minutes before we started recording. You are so visionary. You are so on the cutting edge with your thinking and your ideas and your creativity. So just so honored to be here with you.
Well, thank you again. And I'm glad to relive this with you a little bit. And
Yeah.
please continue your story. I'd love to hear
Yeah.
more about your path and journey.
Yeah. So I was thinking that this community that you've created around positive health, those of you listening, watching might be interested in. I won't go into great detail here, but after leaving the residency and starting my own coaching practice, I landed a position with Humana, which at the time, I don't think I realized the significance of it, but Humana had just acquired a coaching model that was developed by the VIA Institute. So Martin Seligman was one of the founding members, just an incredible force in this movement of positive psychology. And this coaching model was brilliant because positive psychology wasn't just tacked on, positive psychology was at the core. So because it came from VIA, of course, strengths were a huge part of that, which are so empowering when a person can identify with those strengths and actually know that they can call forth whatever strength is needed in the moment. They're empowered. It's it's a something that for a lot of people is so new. And the model incorporated visioning. So lots of research in this last decade or two around the power of visioning and how creating that compelling vision for where a person wants to go. Instead of, in healthcare, we have such a problem-based mindset, as everyone listening, I'm sure, is aware of that. Visioning creates this reference point of, what is it that you want to move toward? What is it that you want to, who do you want to become? What do you want to do